Why do bronchodilators work differently for CF patients? Imagine trying to open a door that's blocked by a thick curtain of mucus and damaged hinges. That's similar to what happens in the lungs of someone with cystic fibrosis. The way bronchodilators work in these lungs is quite different from how they work in other respiratory conditions like asthma. This is because cystic fibrosis causes a complex set of changes in the airways, making treatment more challenging and more personalized. Bronchodilators, mainly beta-2 agonists like albuterol and levolbuterol, are designed to relax the smooth muscles in the airway walls. When these muscles relax, the airways widen, making it easier to breathe and helping clear mucus. In people with cystic fibrosis, this process is not as straightforward. The thick, sticky mucus that characterizes CF can physically block the airways, preventing bronchodilators from fully opening them. So even if the muscles relax, the mucus might still block airflow. Additionally, CF causes ongoing inflammation and structural damage to the lungs, such as bronchiectasis, which is a permanent widening of the airways. These changes reduce the flexibility of the airways, making them less responsive to bronchodilators. Sometimes, instead of opening the airways, these medications can even cause paradoxical bronchoconstriction, which is a narrowing of the airways in some CF patients. Another important point is that bronchodilators in CF may not improve mucus clearance as much as they do in asthma or healthy lungs. While they can help loosen mucus, the abnormal mucus properties in CF mean that the effect is often less significant. Anticholinergic bronchodilators, which block certain signals that cause airway narrowing and mucus production, are sometimes used, but their benefits vary and are less well established in CF. Because of these differences, doctors often personalize bronchodilator therapy for each CF patient. They might recommend using bronchodilators before airway clearance sessions to help loosen mucus and improve the effectiveness of other inhaled treatments. However, not everyone responds the same way. Some may see little benefit, or even experience worsened airway function due to the unique airway mechanics in CF. In summary, bronchodilators work differently in cystic fibrosis because the thick mucus, structural airway damage, and inflammation all alter how the lungs respond. The effectiveness can vary widely from person to person, which is why treatment plans need to be carefully tailored and monitored by healthcare professionals. Always consult your medical team to determine what's best for your specific situation and to ensure safe and effective use of these medications.